Myocardial infarction is more commonly known as heart attack. Myocardial infarction exists when there is decreased blood flow to the heart due to coronary artery disease, such as atherosclerotic plaque that ruptures and formations of thrombus in the coronary artery. Assessment of a client with myocardial infarction includes chest pain that radiates to the arms, back, neck, and jaw. It also includes shortness of breath, cold sweat, fatigue, and stomach pain. Different diagnostic procedures are used to identify the presence of myocardial infarction. Commonly, we use electrocardiography to identify different ECG tracings. This may include ST depression, ST elevation, T wave inversion, and the presence of pathologic Q wave. We also assess the cardiac enzymes because these are expected to increase. Primarily, myoglobin will initially increase, followed by troponin, creatinine kinase, AST, and LDH or lactic dehydrogenase 1. We also use coronary angiography to identify the location of damage and the extent of damage. So when caring for a patient with myocardial infarction, what are the treatments to be included? We tell the client to have a good rest, to conserve the energy and oxygen needed by the heart. Oxygen administration, the use of nitroglycerin and morphine sulfate for pain relief, and aspirin to reduce the chance of having stroke. So let's try to identify whether we've learned from this topic. Which of the following facts should be included when caring for a client with myocardial infarction? Select all that apply. 1. Coronary artery disease is the most common cause. Yes. 2. Oxygen and nitroglycerin should be given. Yes. Morphine sulfate relieves the chest pain of a client with myocardial infarction. Yes. Number 4, allow the client to work in the garden area. No, as we consider having a good rest is important for a client to conserve the oxygen needed to sustain the functions of the heart. 5, aspirin is ordered to prevent stroke. Yes. And 6, ST depression, ST elevation with T wave inversion are commonly occurring in a client with MI. Yes.